Greetings, I'm Dr. Jihan Abdul Haq, and welcome to Raising Resilient Minds. It is a podcast where we explore and discuss ways of helping our children to thrive in their best situations. So today, I actually decided to have a one on one conversation with you. And why, you may ask, is because I'm continuing to see parents who seem to be at their wits' end. And why, you ask? Because their children are not listening to them at all. It's as if we have lost the battle and they have all the power. And now we are going to work every day. We are taking them to their activities, yet we are not being treated in the best of manners. And unfortunately, some of the things that I see that are triggering this or causing this actually have to do with how many of us grew up. For some, it was so harsh, right? It was like, you must eat this, you must do that. There was no middle ground. And so when you became a parent, you said, I'm not going to be that tough on my children. I'm going to allow them more flexibility and more options. And yes, we should allow our children more flexibility and options, but we also have to in place limitations and boundaries because that's a part of being a parent. If we don't put any limitations or boundaries, then we're simply just their friends, which we can have a cordial relationship and a quote unquote friendship. However, it should be one of parental friendship versus I am just like what some people say, your little friends, right? I don't want to be treated in the same manner that you would treat them. So I want a lot of us to just go back and think to ourselves, what if your parents had given you zero boundaries, okay, and just let you do any and everything? Would you have made the right decisions and continued on a correct path? I know for myself that many of the restrictions that were placed on me as an adult, I realized, oh, now I understand why you didn't let me go spend the night at so and so's house. Or maybe I understand why I wasn't able to go to XYZ thing or purchase this thing. It still was difficult during that time, but as an adult, I understand it. So, one of the things that we want to do with our children is to teach them very early restriction, right? Take, for example, one of the things I see in the office quite very often is tablet use or use of the parents' phones. And when the parents don't allow the phones to be used or the tablet, the child flips out, they have a tantrum, and it's very difficult to get them back. And I realize is that child feels like they have to have that thing, that it's not a privilege, right? It's something that they assume is always going to be there, and it's assumed that it's something that they will always get. So, what is it that you can do as a parent? Starting off, if you allow your child to use your phone or to use the tablet that you purchased them, which is technically still your tablet, then you set aside some time, right? When we go to the pediatrician, I'm going to let you use the phone for 5 minutes. So then they get to use it. Maybe you set a timer and it goes off. And then that's the end of it. So many children, of course, will, I want to get back. I wasn't finished. I understand, but I said that you could use it for 5 minutes. So imagine if we put some limitations or structure, right? Every time they're using devices. I'll go for our older children. The video games shouldn't be something that they assume that they just automatically get to play and that they get to spend as much time on them. You need to set restrictions. You can play between this time, and then you must get off. You can ask for additional time. You can earn time, right? So if your room isn't clean, the house isn't clean, the dishes are a mess, no one should be on the game. And that's not being mean. That is teaching them responsibility. That is teaching them to be a partner inside of the home, a team player inside of the home. I think sometimes we feel like we're being mean to our children, but it's actually more detrimental for us not to teach them any of these skills or tools. Because when they finally get a job, the job isn't just going to let them do whatever they want, right? We want them to experience what I say disappointment, a little bit of disappointment in a safe space, right? With you within your home, where they're like, well, I really wanted to do that right now. But you're like, well, you can't do that right now. So they're disappointed. You can reassure them, validate their feelings. I understand you're very upset that you can't continue the game right now. However, I asked you to clean your room and you didn't do that. That's teaching that if you don't do something, that there is a consequence, right? because I'm seeing so many young adults being fired from their first jobs because they don't really understand consequences, right? They were allowed to do a lot of the things that they wanted to do whenever they wanted to do. They were allowed to speak to their parents in any way, shape, or form. So they go to a workplace and they do the exact same thing. And they also, no one ever tells them no, or no one ever critiques them just a little bit. And so that disappointment is felt in an unsafe space. So they often will quit and or say something and they'll be fired. So these are lifelong skills that we as parents have to start instilling in our children. You are not being a mean parent by being a parent. Okay. And I said nothing about corporal punishment. I said nothing about spankings, putting none of these things, right? This is simply setting the stage for future growth. Okay. Starting from when they are very, very little. So, one of the things that I notice a lot with teenagers and preteens is social media. Obviously, I'm using social media and different platforms to communicate these messages to you. So, social media has some benefits. But we have to be very careful with social media in our young children and our preteens and teens. Young children should not have social media. The recommendation is actually 8th grade to actually get a phone. And obviously, the recommendations for social media are dependent upon those platforms, right? They tell you what age that you have to be in order to actually sign on. And I completely understand that it's a lot of fun, that there's a lot of things that we're doing. However, are we paying attention to what they are watching and what they are listening to and what they're exposed to? Because unfortunately, when you go back to look to see what they did or what they were viewing, it's too late. They've already seen it. They've already been exposed. And now the question is, what do we do when they're exposed to things that we weren't ready for, to have those explanations, to have those conversations? And obviously, that's often when people come to the office and ask me, well, what do I do? I didn't expect them to watch this video at 8 or 9. And that's when I'm like, you know what? Let's set them up with a therapist so they can discuss what they saw and how they feel about it, etc. But sometimes we never know what they saw and we just see them acting out certain things that you're like, where did you get that from? That's not something that I've exposed you to or you've seen in the household. And I'm pretty sure you didn't see at school. So it's that monitoring and that preservation of innocence that I think is very important. We're allowing our children to grow too quickly. And when they're young adults at 10, without the actual brain development that controls for that impulse and that self control, then we get ourselves into these spirals of children who are just out of control. And as parents, we're just sitting back like, what do I do? That brings me to my next conversation with you all, and that is the accommodations. So, because of our own past and our own histories and in relationships with our parents and grandparents, we often are like, you know what? I'm going to make things better for my child, which is great. Okay. Don't get me wrong, but we overdo it. We accommodate so much for them that they don't know how to do things. And this actually often can create a little bit of anxiety. And then when they have the anxiety, we often continue them down that road. So think about it like this: your child is struggling to get a jar open, right? Let them go ahead and struggle for a little bit. Don't just come over and automatically open up the jar. Why? Because once they struggle, then they'll actually know how to open it. Okay? If that makes any sense. Other things, your child may say, you know what? I don't want to eat this food for whatever reason. And then we go make a whole new meal based on what they said. And the question is, why? What are we teaching them? If you don't want something, I will just do whatever you want. So when they're at school and they have to eat school lunch, what do? They just don't eat anymore because they're like, I'm only eating the foods that I want to eat versus children who are able to adapt. We never know what may come from this world, right? When you think about famines and you think about war and all these other things, imagine these children. They're not used to just having to eat anything. Are they just going to starve? Hopefully not. And most children, I'm assuming, would just go ahead and eat. But we don't want to set them up for these situations where food may be scarce. but they're not actually able to indulge in these things because they're so used to being accommodated. Not only that, but it actually reinforces their dislike of that food because it's almost like you're saying, you know what? You're right. This isn't very good. So I'm going to make you something else that tastes better. So try your best not to do those accommodations. Instead, offer them the plate, let them know they can eat what they like, and you might put it to the side. But one of the things I enjoy doing is I just ask my children, what are some things you would like to eat? So it's not necessarily a true accommodation, but it's a conversation where I'm involving them in the process of cooking as well as meal planning and grocery shopping. And then we'll go online and we'll explore new recipes. And I also have to get a shout out to website Dr. Yum, and it's YUM, because she actually will allow you to put in different things in your pantry and then it'll roll out a recipe or a menu idea, which I love doing with my children and also explaining to different patients and families because even the pickiest of eaters often will keep going until they see something that they're willing to try. But instead of us creating two meals, we're only making one meal because we did a little bit more preparation. So and continue talking about accommodations. Sports, I see that big time. Kids will just quit a team, start a sport, quit. I don't like it. So you just quit. That's not really teaching them how to persevere, how to overcome obstacles, right? There's a difference between making your child stay in a sport for years that they hate versus making them try things out for a few weeks to see if they really, really enjoy it. I see so often where children will just give up or they'll change a team because they didn't like something that happened. And we just have to really teach them to be able to overcome things. So then you validate their concern. You know what? I agree. I don't really like the way your coach talked to you, but how is a different way that you might be able to approach when someone speaks to you in that manner? That's one thing. But also, as a parent, maybe you having a conversation gently with that coach to say, my child doesn't respond as well to the way that you coach. What are some things that we can do together? And hopefully that's a person who also knows how to communicate and you can have that conversation. If it isn't, then of course you can reevaluate things and the situation. I give an example of my own child. He ran track and he loved track. And then he wasn't getting first place anymore, or second, because he didn't grow as tall as some of the other kids. And so I noticed he started to hide. I couldn't find him for track practice. And that was when I realized, you know what? We have to stop this. Spoke with the coaches, changed quite a bit of what we did, let him finish the season with those accommodations, but he still finished the season. Okay. So there's a difference between accommodating where you just pull them, right? Versus acknowledging the issue, finding ways to fix the issue, and then making sure that they, are finishing things out. Accommodation has its place. It's just making sure we don't take it too far where we don't allow the child to experience, some difficulties and obstacles because through difficulty and obstacles is how we as adults grow and learn, right? If everything comes easy to us, when something doesn't go well, our worlds fall apart. And I'm seeing so many youth where that's happening. Everything had to be perfect. Everything, if it wasn't perfect, the parents stepped in to make sure the project was perfect. The parents stepped in to make sure this happened so it was perfect. And so when the child isn't perfect, when they go to college, everything falls apart because we set this precedent that is not attainable. And unfortunately, our children and our young adults are the victims of this precedent that was set. It's important that we reinforce for our children that it's okay to mess up. It's okay to fail. As my husband likes to say, fail forward, right? Every time you have a failure, you're still moving forward and realizing and learning from what happened and realizing that things are just so much bigger and that we all have some sort of failure or obstacle. And if we don't, I really want to meet this person because I just don't see how you possibly could go through life and nothing, no failures or anything. So that's just something to keep in mind. When we speak about younger children, one of the biggest things I see in my clinic regarding accommodations is parents allowing their children to sleep in their bed. And it started off very innocent when they were little, and we were probably very tired, myself included. But then I realized, hold on, I'm accommodating some fear that you must have. And so it's very important that we try to get them to stay in their beds. There's lots of tools and things that you can do, whether it's white noise, spraying lavender, essential oils in the room or diffusing them, reading a story to them, getting them a life-size bear or something like that that they can cuddle and hold on to. But it's so important that very early on, you're encouraging them to sleep in their own beds versus getting in your bed. Of course, as a pediatrician, the first 6 months of life, we do often recommend that children are in a crib inside their parents' room, not inside the bed. But as they get older and they're able to sleep in their own, room, then we definitely do recommend and encourage this. Another thing is if you have a child who may be a little anxious or a bit of a worrier, and you always respond quickly to their phone calls or their text messages and things like that actually can be a little detrimental as well because that child doesn't know how to lessen their worry about where you are or what's happening. And it's something that can just create a little bit more anxiety. So just realize a lot of these accommodations that we make could be for children who actually are experiencing anxiety or worry. And so we're feeding into that. So putting those limitations and putting up some of those barriers to where we're aiding them to be able to process and to even think about things a little bit differently, so we can get them out of that cycle of, well, where are they? What are they doing? What's happening? Da da da. Just something getting them out of that cycle is very, very important. And I want us as parents to take back the reins. Okay. You are the boss. All right. I know we like to call kids little bosses, but no, you are the boss in the household, and you deserve to be respected for all the work and the things that you do, as long as we're doing it. If we're just sitting around and doing nothing, that's different. This isn't a podcast for you. We're here trying to raise resilient minds. And the way to build that resiliency is for us to teach them about boundaries, struggles, obstacles, perseverance, and the fact that it's okay to fail. Okay? Learn from everything that happens to you, learning from every obstacle, being able to experience failure in a safe space. I will just reiterate that because you don't want them to experience it only in the outside world. And especially, you don't want them to experience it on their first job because that may impact future employment as well because they're afraid now, right? To even go out and get these jobs. And so we're hindering them as young adults as well. I think sometimes we forget that teaching that little kid to sleep in their room, teaching that little kid to at least try the food on the table, that I'm not going to make you a new meal, are all little building steps, right? That we're giving to our children so that they then become adults who, one, can show up to spaces that may be a little scary, right? Which could be a job interview, that they can sit at a luncheon with the CEO and actually order from the menu because they're not so picky and so used to being accommodated that now they're just sitting there and they look pretty bad. And I share that story just because I personally, as an employer, was in a situation in which my employee took them to a very nice restaurant and they couldn't order from the menu. And I was sitting there, oh, wow, this is something from childhood. And yes, there are lots of conditions and things like that that can cause sensitivities, but that means we need to get them the help that they need, right? They need to get the feeding therapy. If they have RFID or things like that, if we need to do some cognitive behavioral therapy over anxiety about certain things. So just because a child has something doesn't mean that we have to say, this is just the way that they are. No, they are able to be resilient, right? And moldable. Therefore, we need to give them the tools and the skills that they need so we're able to increase that resiliency, okay? So that they're able to survive and make it in this world. And so I personally invite you all to step up to the plate and take back your households, okay? From some of these little terrorizers who are you just I don't know what to do. Just remember, right, that this is your show, okay? You are the lead actor in this space, right? And no one's going to take over your lines. But we just have to tread gently, okay? Like I said, we acknowledge their feelings, we acknowledge their concerns, acknowledge their frustrations, but this is the way things are going to go. And the more that your child sees that you validate them and then you move forward, then they start to say, you know what? I understand. I'm a little disappointed, but I understand. And then maybe we can work together and come together for some of these things instead of it just being a tantrum or just getting upset or slamming the door, etc. Okay. And this is us also removing when you have to get a spanking for something because you're acting out. But I didn't give you the tools to learn how to calm yourself. I didn't give you the tools how to even vocalize things appropriately for yourself. We're just having a screaming match versus me telling you calmly, hey, I understand you're upset. I need you to calm down. And this is how we're going to go forward. So just bringing back that ability to just calm ourselves and approach the situation. And as a parent, when you validate their feelings and it actually sometimes can calm you a little bit, I know it helps myself because I'm like, well, what? You know what? You're right. You have a right to be upset that I took your phone. You have every right because now you don't get to talk to your friends or whatever might be the situation. However, you didn't do this, and therefore you didn't adhere to the rules that we have set in this household. And there are consequences to that. And that's the end of the story. And we can discuss it later about how we can move forward in the future. So that's more for your teenagers, obviously, because they have a lot to say and they're going to debate you about a lot of these things. But stand firm. Stand tall. You have this. You're like I said, you are the lead actor in this situation. And it is so important that you teach your child how to become more resilient so that they're able to thrive in this crazy, crazy world that we live in. So, again, I'm Dr. Jihan. You can visit me at drjihan.com if you'd like to work with me. I do offer some mental health coaching for those parents who are in need of that, as well as if you are in a state that I'm licensed in, I can work directly with you with diagnosing and treatment of several different mental health disorders. This is Raising Resilient Minds, and we're so glad that you joined us and tune in to our next episode. Take care.